Hello, thank you so much for joining me. Today we're doing a small movement snack. We're just going to focus on one area of the body and we're going to mobilize this area. We're going to try to do it intentionally. We're going to focus on what our body is doing in space. So we're going to be looking at it with our eyes. We are also going to try to focus on what it feels like on the inside. I also want you to be aware that when we mobilize our knees, snap, crackle, pop is totally normal. We are organic beings. Sometimes we have pockets of air in certain places in our joints that pop. My fingers just popped. It's absolutely normal as long as it's not accompanied with pain. Do these as long as you have no tissue damage in the knee area. And this should help keep the area mobilized, keep it from reduce. So as we age, we do tend to find that our range of motion is reduced. We do find maybe we have stiffer knees, maybe we have more painful knees, maybe we have more cacophonous knees. This is going to help keep that area nice and strong, and increase range of motion in the area and better body awareness too. So if you're hypermobile like I am, keeping ourselves from getting injured and tearing ligaments and tendons is really important. And doing it through mindful joint rotational movement, like I'm about to show you, is a great way of decreasing our chances of injury. Okay, so what we're going to do is we are going to stand with our legs directly underneath our hips. Okay, place your hands wherever comfortable. I like to place them here for this one because we're going to mobilize both knees at the same time. So for now, what I want you to do is just bend the knees forward and then bring them back to directly underneath your hips. You can lock them, that's fine. As long as you do it gently and you're looking at the knees. You can place your hands on your hips if you want as well. You can hold onto something, but I really want you looking at your knees. I want you to try to get them past your toes. This helps maintain mobility in the knees. You don't want to restrict what your knees can do just because you're being told that you should keep your knees behind your toes. That is a myth. There's nowhere in science that says that our knees are more susceptible to injury if they go past our toes. And we're going to do this a couple more times. You're going to feel it. So if you have tight calves, which is absolutely normal, especially if you're not regularly mobilizing, you might find that you're not able to get those knees past the toes, and that's okay. The more we work on a particular skill, the better we get at it. Okay, we're going to come back, extend the legs. Now what we're going to do is we're going to bend those knees. I like to place my hands right here so I could feel the motion because we're going to make circles over the foot with the knees in tandem. Okay, we're going to shift those knees over, making sure your feet are planted on the ground. We're going to bring them around over the toes and back to the other side, extended. Okay, bend, 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 move over to one side, rotate those knees around, bring them back to center. We're going to do this 6 more times. Let's do 8. Bend, shift, bring around and back. Bend, shift, bring around and back. We have 4 more. Bend, shift, bring around and back. Bend, shift, bring around. 1 more. I might be off. It's okay. Okay, we're going to go the other direction. We're going to bend, shift the other direction, come around. Boom. Shift, come around, back to square one. Shift and rotate. Now what we're trying to do, smoothing out every rough edge, making every subsequent circle more perfect than the last. Notice how my feet aren't really moving very much. So even if that means that your circles are smaller, that's okay. We all start somewhere. I'm going to do 2 more, and then we're going to move on. 1, shift, rotate, back to center. Okay, now what we're going to do is we're going to plant one leg, shift the weight onto that leg, Take the other leg, bring it on in front, place your hands on your hips. Okay, same concept, isolating one knee joint at a time. We're going to bend the knee, shift it over to one side, let it rotate around. Now notice my hip is going to accommodate this movement by shifting downward, but it's the only other movement in my body while I'm doing this particular drill. So I don't want your upper body shouldn't be moving. Your pelvis really shouldn't be moving except to come down to accommodate the knee being bent. Okay, so bend. Notice the hip shifting, come out to side to round, and the hip shifts back up when we extend the leg. Okay, so we're looking down at the knee. We're making circles. We're making as perfect circles as possible, smoothing out every rough edge, making every subsequent circle more perfect than the last. We'll do two more. And then two. We'll reverse the circle. We're going to bend, shift to the other side, rotate that knee around the foot, and come back. Okay, so that's one. Two, we're looking down at the knee. We're allowing the hip to come down to accommodate the movement. Breathing in through the nose, out through the mouth. We'll do one more in this direction, and we'll switch legs. Boom. Bring the leg back. Shift the weight onto the other leg. Take the leg we weren't working with, bring it to the front. Just take one little step. Now, the amount of weight that you put on the leg in front of you is dependent on how confident you feel in doing these knee circles with added load. Okay, so you could do these with all your weight shifted onto that leg. But if you're not very comfortable doing that, shift the weight onto the leg that isn't being worked on, and we just focus on bending the knee and creating circles. Okay, so we're going to bend the knee, shift to the outside, come around and up, bend, come around, smoothing out every rough edge, making every subsequent circle more perfect than the last, making sure that we're just allowing our hip to come down to accommodate the movement. Everything else remains stable and steady. We're going to do two more. One, two, come back to center, bend the knee, shift to the other direction, internally rotating, coming around the foot and back to center. So that's one, two, three, we'll do six, four, five, six. You could always add more. These are gentle enough to do daily. You can do them throughout the day. Sometimes when we don't have tissue damage, but we've had previous injuries, our brain wants to send signals of pain or stiffness in the area. And sometimes all it needs is a little intentional mobility to help reduce those signals. So that's it. That's the workout. Hope you enjoyed it. If you have any questions or concerns, always feel free to DM me, hit me up if you don't know where to start, if you don't know which workouts might be more beneficial for you, or exactly how to get started setting up your own program. Hit me up. This is what I'm here for. DM me, email me, shoot me a comment. Anyway, hope you all have a lovely, beautiful, symptom-free day.